About 5 years ago, I went through a very traumatic experience in my life that resulted in a very acute case of depression, and I just couldn't get out of bed. It was horrible.
I was critically ill for 2 years due to taking the wrong prescription medications. I couldn't walk a straight line, I could barely stay awake. They just couldn't really put a pin on what was wrong with me.
1 in 4 Americans in their lifetime will suffer from a mental health disorder, and less than half of those patients will respond appropriately to their treatment. And GeneSight is able to help their physicians every day get them on the appropriate medications.
GeneSight is a simple test where we use a cheek swab to collect your DNA. We process that DNA in our lab to understand how your genes will impact how you're going to respond to medications. In 3 clinical trials, we've actually shown that patients will double their likelihood of responding if a doctor knows which medications to avoid and which medications are genetically appropriate for that patient to select from.
The GeneSight test is a great breakthrough in our field of selection of medications for patients. For the first time, we have some real science there.
I really believe in the science behind it. I can choose the right medication on the first or second trial and to bring them to remission in the shortest amount of time possible.
I wanted to have my life back. I found this test and it changed my life.
After I got better, I went back to graduate school and got 2 master's degrees. Now I'm using both of them in a library position, and I love it. That is something I don't think would have happened if I had never gotten the GeneSight test.
It's just a cheek swab. Get it done. Just get it done.